Hi everyone, my name is Ashley Tufel and today we will be discussing aneurysms. And in this presentation, I will be discussing what an aneurysm is, the different types of aneurysms, some risk factors as well as signs and symptoms, and also an exercise prescription. So let's start off with what an aneurysm is classified as. Well, an aneurysm is a weakening in the artery wall, which can cause a bulge or widening. As you can see from the bottom left picture, it's almost as if the blood vessel has developed a balloon type attachment to it. Some interesting factors about aneurysms is that every 8 minutes an aneurysm will rupture, and about 50% of these individuals will die within minutes. So it's important once you discover you have an aneurysm that you should rush into the emergency room immediately, for this could be death-threatening. 1 in 15 people will actually develop a brain aneurysm, and approximately 6 million people will have a brain aneurysm, and this could be known or unknown. The most common ages to have a brain aneurysm to occur is between 35 and 60, but you could develop it at any age below or above these age ranges. And our interesting fact is both men and women can develop aneurysms, but the ratio between women and men is women are 3 to 2. So it's more likely that women develop brain aneurysms over men. So what are the signs and symptoms you should be looking out for if someone were to have an aneurysm? Well, if it occurs in the brain, they will most likely will be having a strong headache. They could also develop pain anywhere from the head down, depending on where the aneurysm is located. They could experience clammy skin, as well as nausea or vomiting. And they could also develop low blood pressure. So those are some things you should be looking out for. What are some factors that could cause an aneurysm? Well, the number one thing is family history. If a grandparent or a parent has had a brain aneurysm or any type of aneurysm, it's more likely that you could develop an aneurysm. So it's always important to know your background, and if it does occur in your family, you should get checked. Another factor could be high blood pressure, high cholesterol, and also if you are a smoker, you are increasing your risk to have an aneurysm. So if anyone is showing these signs or factors, the first thing you should do is go see your practitioner and get diagnosed. Most likely they will have you get a CT or MRI scan of the location to see if you do in fact have an aneurysm. And the next is treatment if you do show a aneurysm. If it is the worst case scenario, you most likely need surgery to remove or block this aneurysm from happening. If you are experiencing the symptoms, you should start taking pain relievers such as Tylenol, especially if you're developing a harsh headache. Once treated for an aneurysm, if you did have any post-traumatic symptoms, such as loss of balance or loss of movement, we would probably tell you go get therapy, occupational or physical therapy, to get your movement back. So there are 3 different types of aneurysms: abdominal aortic aneurysm, cerebral aneurysm, and thoracic aortic aneurysm. And from this chart here, most likely the ruptured aneurysm, 69% of these patients most likely won't have a disability or very low mild disability after experiencing one of these aneurysms. So first, we'll start off with the abdominal aortic aneurysm, and this will most likely occur in the abdomen, but it can also occur in the pelvis or legs. So as you can see by this picture here, a normal artery there will flow through, And to the right of it, the abdominal uh, artery is bulging. That will show that it does have an aneurysm occurring. So some symptoms who have this type of aneurysm could have pain in the abdomen or also the back. They could experience some nausea or vomiting, or you should also check if they have a mass by their abdomen. Some risk factors that people could have with this is men over 60. If the patient is developing high blood pressure, have a background or family history of abdominal aneurysms, have high cholesterol, is overweight or is obese, or is also a smoker. Next is cerebral aneurysm, and this type of aneurysm occurs in the blood vessels of the brain. Some symptoms could be a severe headache, double vision or blurry vision, as well as pain in the neck or eyes. And as you can see here in the picture, it shows a blood vessel in the brain and there's a bulge coming through. Lastly, here's the thoracic aortic aneurysm. So this will most likely occur in the chest area. Some symptoms will be swelling of the neck, the chest, or upper back. This person could be vomiting or nauseous and could also have a rapid heart rate. Some risk factors could be just plain aging. The older you get, the inflammation of the aorta or blood vessel, or this can also occur if you fall or any injury that's involving to a blow to the chest. So a case study that I researched for this type of aneurysm is a ruptured cerebral aneurysm. This particular person is female. She experienced this ruptured aneurysm at the age of 55. And as you can tell by this chart here, that between 50 and 59, she falls in that category that with a total of about 75 patients, 50% of them were female. So most likely female at this age will develop a aneurysm. She is a special ed teacher. Her height is 5'5" and around 110 pounds. And what's interesting with this patient or case study is she showed many risk factors and signs and symptoms of someone who could have an aneurysm. She is a current smoker. She has had high blood pressure in the past, and she's also experienced a heart attack at the age of 40. When I asked her about the aneurysm, one of the major signs that she experienced was a high headache. She had to lay down, and her headache actually developed worse over time, where she was rushed to the hospital, where they checked her and saw that she had an aneurysm in her brain, and they had to perform surgery. Now, post-surgery, exercise prescription that typically would be advised is both aerobic and resistance training. We want them to continue their daily life activities as much as possible. Usually the exercise prescription would be 3 or more days per week. We would start them with low to moderate intensity, which would start anywhere between 15-20 minutes. We want some stay low, very casual type of exercises, very comfortable. They can start walking or swimming to have resistance, as well as yoga, especially if they developed a aneurysm in the brain and they have lost balance or coordination. Yoga would be a great starter. The research who I researched on this exercise prescription really emphasized on increasing endurance, range of motion, and daily life activities. I hope you enjoyed my presentation and learned a little bit more about aneurysms. Thank you.